Now focus on the palpation. In palpation, there are a lot of named tests that are important. But before that, the temperature, tenderness, if any tenderness present on pressing the veins, and the calf impulse by pressing the thumb or by pressing the saphenofemoral junction with the thumb. If the impulse is feeling while coughing, it should be checked. So these things are not so important, but we have to check for the completion. Now the first important test is Trendelenburg test. Carefully listen the steps. First, we have to make the patient supine. We have to make the patient supine. Then we have to press the whole leg and milk whole the venous superficial venous blood into the femoral venous system. Like we have to press along whole the leg and send whole the blood on the femoral vein or the above tributaries. So first we have milk down all the blood that is present in the veins. Milking is done. Now no blood is present in the superficial vein. We cannot milk down the deep vein because it is not possible by pressing the superficial area. Now tie the tourniquet below the saphenofemoral junction. We have to tie the tourniquet below the saphenofemoral junction so that the blood from the femoral vein cannot come to the superficial veins. Now we have to make the patient stand for 2 to 3 minutes. First, two things may occur and one thing is different. What happened? After 2 to 3 minutes on standing, we have not releases the tourniquet, but superficial veins below the saphenofemoral junction got distended even before releasing the tourniquet. So we will say that there is incompetence of the perforators. Look on this picture. This is the superficial vein and this is the deep vein. The perforators or the valves are present in between the superficial and deep vein. Normally, the blood will pass from superficial to the deep veins. But if there is perforator incompetence, the blood will flow from deep to the superficial. Here in this case, if this valve is incompetent, then the blood will pass from deep to superficial and make this vein dilated. So actually this is, if this is superficial and if this is deep, the normal flow of blood should be superficial to deep. But if the valve here is incompetent, though I have tied the superficial veins above and below, or above as below is nothing there, but blood will flow through this and it will make the vein dilated. So superficial veins before saphenofemoral junction got distended or dilated before releasing. So we will say that the perforator below the perforator below the saphenofemoral junction are incompetent, or perforator incompetence is there. This is called as positive Trendelenburg test. Now, after 2 to 3 minutes of standing, we will release the tourniquet. We have checked that yes, the superficial veins below the saphenofemoral junction has distended even on not releasing the tourniquet. But if after releasing also the tourniquet, if the filling increases, it will be called as saphenofemoral junction incompetence, because in this case we have tied the saphenofemoral junction. Now, when we have uh, dislodged or released this tourniquet, if the filling increases, it will also denote that there is saphenofemoral junction incompetence. It can also be checked by immediate release. If after immediate release of the tourniquet, the filling rapidly increases, we will call that saphenofemoral junction incompetence is there. So there are two possibilities, the two positive, positive, negative, negative, positive. These two are, one is saphenofemoral junction and one is perforator incompetence. This two mentions this signs. That is the most important test, or Trendelenburg test. Now we will do the one important test, two tourniquet test. It helps to localize the perforator incompetence. We have to first lie down the patient, milk down whole the superficial venous blood, then first we will check the adductor canal perforator. For that, we will tie two tourniquets, one just below the saphenofemoral junction and one the perforator above. That means if here is the above knee perforator, then we will tie the tourniquet above it, that so that here only adductor canal perforator is present. So if adductor canal perforator is normal, I have mentioned that blood can only go from superficial to deep. So blood will not be, we will not see any kind of dilatation. But if perforator is incompetent, blood will flow from deep to superficial, and we get to see the distended or dilated veins. So we will tell that adductor canal perforator is incompetent or competent based on the dilatation is present or not. At the same way, we will check the above knee perforator. If it becomes dilated, even tying, then we will say that above knee perforator is incompetent. If it becomes normal, we will say that below knee perforator is normal. Or and the perforators are adductor canal perforator, above knee, below knee. Now if here is the medial malleolus, there are three perforators. One is 15 centimeter above medial malleolus, one is 10 centimeter above medial malleolus, and one is 5 centimeter above the medial malleolus. These all perforators should be checked. And if feeling present, as I have mentioned, the test will be positive just because there is perforator is incompetent. If feeling is absent, the test will be negative. Now we have to look on the Schwartz test. In the Schwartz test, we will place a thumb, no further milking. We will place the thumb in the saphenofemoral junction and we will tap at a lower level. If the impulse achieves, or if the impulse achieves the height to the saphenofemoral junction or reaches to the saphenofemoral junction, we will say that there is a gross varicosity. That is because to achieve the height of the saphenofemoral junction, venous blood have to travel a lot. So impulse is going to that height. That means there is a gross varicosity present. This is the Schwartz test. Now we will do the Parthis test. This is also a very easy test. We have to put the tourniquet without milking and we will say the patient to walk for some period. Here also the same thing happens. Normal flow of the superficial. Normally the blood flow from superficial vein to deep vein. But if there is deep vein is patent, the superficial blood can easily glow into the deep veins. But in valve incompetence, the blood can regurgitate back. But in this Parthis test, we mainly check the deep veins. Now, after walking, if distended veins are collapsed, normally there is varicose veins is present. Now after walking, distended veins have collapsed. So the blood from superficial vein has went into the deep vein. That is very normal. We will call that there is a normal deep vein. But if there is a thrombus in the deep vein, can the blood pass from superficial to deep vein? So blood will remain in the superficial vein and we will get to see the tortuosity in the superficial veins. So and it will also cause further feeling and pain. So we will tell that there is the deep vein thrombosis is there, or any kind of occlusion is present in the deep vein. The Fagan's test is very easy. We have to palpate along whole the venous route where the perforator is. If we can see a crescentic gap in the deep fossa, we will say that the Fagan's test is positive. So these are the named tests: Trendelenburg test, two tourniquet test, Schwartz test, Parthis test, and Fagan's test. We have to also look on the arterial pulses like arteria dorsalis pedis, femoral, popliteal, and posterior tibial, and we have to auscultate to check if there is any bruit present. Bruit indicates emboli. Finally, we will follow a scoring system that is very easy to ascertain the stage of the varicose vein or how it is present. So clinically there are C0 to C6 and A and S. A and S means asymptomatic and symptomatic. First write that down. Asymptomatic and symptomatic. Now C0 means normal, so no disease. Now focus on C1 to C3, C4 to C6. C1 means telangiectasia. Telangiectasia means this like reddening or like spider nevi, that's like spider nevi. There will be more area of reddening. C2 means varicose veins, and C3 means there is presence of edema. So telangiectasia, varicose or edema. Remember first C5 and C6. C5 is healed ulcer. C6 is active ulcer. These are the late stage. And C4 is if there is any skin change. It may be pigmentation, it may be eczema or lipodermatosclerosis, anything. Etiology, I have already mentioned. It can be congenital, it can be primary, it can be secondary. Secondary mostly formed from DVT. Now, anatomic classification, it is superficial, it can be deep, and it can be perforator. The involvement of deep vein and perforator. Involvement of deep vein is checked by the Parthis test. Now pathophysiology, there can be reflux, there can be obstruction, and there can be combination of reflux and obstruction. By this we will give a score. C4 has two stage A and B. You can write that or not. So like C2, uh, A or S, like symptomatic, etiology is like primary, anatomic is superficial, and pathophysiology I caused just obstruction. So we can give a score of varicose vein like this. Now investigation, for investigation we will do the duplex imaging of the veins, and after all this we will achieve to our diagnosis and that this is a case of varicose vein, and with all the findings to be told in the summary of the case. Thanks for watching. If you really like the video, so like the video, share with your friends and subscribe to my channel. Thank you.